Ladies and gentlemen, welcome to MedSynapse podcast series. I'm your host, Dr. Nigar, and I'm super excited to have Sami Mansfield back with us for our fourth podcast on MedSynapse. She is not just an oncology exercise specialist, but also the mastermind behind Cancer Wellness for Life. Sami is all about empowering both cancer patients and the folks taking care of them. Straight from the USA, Sami has a huge impact, shaping cancer control plans and co-authoring game-changing guidelines. And guess what? She's not just a pro in the field, she's a fantastic speaker too. Back in 2016, she rolled out Build, this awesome fitness program designed specifically for cancer survivors. Now, drumroll for today's topic. We are diving into cancer, obesity, and metabolic health. It's a real game changer, and we have stoked to have Sami share her insights with us today. Plus, it's awesome to see her becoming a real part of MedSynapse family. So get ready for some cool insights, a bit of banter, and another fantastic chat with Sami Mansfield. Welcome, Sami.
It's so great to see you, Dr. Nigar. I feel like we've sort of had these fun conversations for several months, but timely, here we are on the new year talking about obesity, the topic of everyone's New Year's resolution. So thank you for having me to talk about this amazing topic, an important topic for our listeners.
Thank you so much for always empowering us with your time and knowledge on very important topics which we miss as healthcare professionals. Now let's dive right in. Sami, with it being the new year, we know that this is when many people focus on their health, weight, and goals. Let's say the New Year resolution. As an exercise oncology and lifestyle medicine professional, what are your thoughts about this time of the year?
Question, as we kind of alluded to, I think we all have sort of this mindset, this fresh new year. We want to make this, new year. We hear new year, new me. And I would kind of banter this to be not new year, new me, because we're the same, but new year, better me. So I do love that the energy towards getting healthy comes at this time of the year. But what I don't want to happen was what typically happens is we only do it for 2-3. The average is literally less than 30 days with this topic and making these habit changes. So I think it's really important to work on long-term strategies that we can each do to improve our overall health, well-being. And as we'll talk a little bit more about metabolic health, that we're not only helping how we're going to live today or this month, but where we're going to be when 2025 comes around the corner and we're standing here being excited about what's ahead. So I think I get excited, but I also have this nervousness that I don't want people to show up to the table with really exciting energy and then lose focus here in a few weeks because they don't have the tools. So I know that that's actually what we're going to talk about today.
I couldn't agree more, Sami. It's always inspiring to see the renewed commitment to New Year's resolutions especially when it comes to health at the start of the new year. But the problem is not everyone follows it. Now, how do you feel about this related to someone with cancer?
Well, I think that's a great question. And I think we tend to say, don't worry about your metabolic health or your weight, really focus on fighting the cancer as an example. We hear that a lot. But what we really need to understand is, number one, obesity is a risk factor, not only for many types of cancer. Right now, we know that there's 13 specific cancers that are related to obesity, but we do know that people that have more obesity are at risk of chronic diseases, which makes the treatments more complex, which makes them probably have more challenging side effects and long-term side effects, as well as increasing their risk for other diseases. So I think that we can't ignore it in the cancer space. And then we also need to keep in mind that metabolic health and kind of what that means as far as being healthy at our foundation, our mitochondria, which are really our cells, is actually one of the things that's most important in reducing disease or the impact of disease. I think people really think cancer is genetic. And really, only 10% of cancer is genetic, where 30% of cancer is related to lifestyle. Largely, we've known that to be more related to smoking, some alcohol use. But I think that we are better understanding that obesity, not just weight on the scale, but body composition and having more fat, less muscle mass, is actually one of those factors that's increasing our cancer risk, as well as really creating less desirable outcomes in cancer and other chronic diseases. So I don't think we can ignore it in the cancer population. Also, our patients ask about it. They see the weight changes and they want to know that this isn't just normal and there's nothing that I can do about it. So I think it's really important as clinicians that we acknowledge it and then really make sure that we're supporting our patients through this next phase once the acute treatment is completed.
Well, we also know that obesity is known to be a risk factor for 13 types of cancer. Could you talk more about what that means for our doctors, both in risk reduction and survivorship?
Yeah, kind of what I started on, I guess, in the first question, I think it's really important that the physicians, all of our doctors know that it isn't just, like we said, weight on the scale, right? We know that some of our individuals that we care for are under muscled. They have maybe a healthy BMI or body mass index, but they have a lot of visceral or abdominal obesity, which is the type of obesity that leads to other chronic diseases beyond cancer, cardiovascular disease, neurodegenerative disease, etc. So for our doctors, it's important to assess our patients not just on the scale or a BMI, but really looking at perhaps physiologically, if they're holding a lot of abdominal fat, we know that this is something that we need to help address in a way that is constructive, and it isn't about just a diet or an exercise plan. But if we do not care for our patients related to obesity, these are patients that typically are more complex. They typically have more other chronic disease needs, require more doctors, require more appointments. It's harder to care for them in a lot of our modern systems because our systems are very siloed. So if we can take care of this at the foundation, the piece that when we're standing in front of us and addressing something that's going to affect all aspects of their life, I think we're not only serving our patients better, but we're serving our care for the patients better by kind of foundationally supporting them, not just sending them off to the next thing, or not just kind of incorporating, what other next step or other doctor there needs to be. This just makes it easier to care for these patients. It's hard to care for patients in a silo when they have 6 doctors. So I think that we all play a role in this. Also, much of obesity does not come from healthcare. It comes from how they live in their world. And we all can share into providing good guidance for exercise, nutrition, and stress management, no matter what disease that we are caring for the patient in. We all have a role in taking care of ourselves in this way, but also delivering that advice also to our patients and reminding them that they can make choices. And sometimes these choices are more challenging, but often they're not that challenging. They can be simple, they can be quick, and they can be free. And I think that's really important when we're caring for patients to think about how they're going to live their lives outside of our appointment visits or outside of the walls of our health systems as well.
It's really an eye-opening to consider how doctors can play a very pivotal role in both reducing the risks and supporting this survivorship. Now, as we're learning more about the role of metabolic health, not just obesity alone, I know you're also a leader in this area. Could we start with an understanding of what this means for our audience, both in oncology and those who may be in other specialties?
Yeah, great question. We tend to try to put things in kind of like a symptom or side effect, but metabolic health really is looking at the overall health of the individual. So in addition to a lot of our blood marker lipid measurements, cholesterol, we're looking at blood pressure, we're looking at abdominal obesity, we're looking at them kind of top to bottom from all of those things that were going to contribute to chronic disease. And I think what's important about this is that we're looking beyond simply one factor is they have high cholesterol, we're treating them with, some sort of a medication, right? But I think that what we need to understand with metabolic health is that even if someone has good blood markers, but they're not sleeping very much. They're eating a highly processed diet. They're not very active. That metabolically, again, remember the mitochondria are the the cells of our body is really our foundation. So if they don't have like a finely tuned engine, if we think about, we have a vehicle and, everything in the vehicle, like all of the engine is like clogged with oil and dirt, we're not running efficiently. It's the same thing for all of us. So mitochondrial health, or metabolic health, I should say, is having healthy mitochondria, meaning at my cells, I'm functioning well. So some of this we can measure really easily in healthcare by doing the labs that we normally do or doing scans. And then the other area of this is looking at someone from their lifestyle factors. So when you're working with a patient and they're telling you they don't sleep very well, we need to understand why. Is it related to something like a sleep apnea, which is of course clinical, or is it because they're having maybe anxiety, or their hormones are off, or maybe they have a really poor sleep regimen? So I think it's important to understand that it's both of those factors, and some of the things that we're going to see in traditional measurements, and other things are the questions that we ask the patients, where we can then bridge those things together. But again, thinking about us from a cellular level is difficult, but is really important in managing health and wellness long term.
Now, why should we focus on metabolic health for everyone and not solely on cancer patients alone? Additionally, how can healthcare professionals effectively implement metabolic health strategies in their practice?
Great question. I think the thing about cancer specifically, and again, I want to speak, from that lens, everyone is either trying to prevent, going through, or has gone through cancer. It is definitely a disease that affects almost 50% of the population universally. So if we can think about upstream and prevention, I think that's really critical in how we can manage care. I know that at least in the United States, we have this really bad habit of saying that prevention for cancer is screening. So make sure you get your mammograms, your colonoscopies, or you check like your PSA markers. And I think that that's important, but that is diagnosis, not prevention. So if we really want to think about the role of prevention, we need to think about upstream, because many cancers are slow growing. Therefore, we need to make sure that we are looking at what we can do to prevent those cancer cells from being erratic as they sometimes do. And I think that that is often ignored. Like, we don't think that we can prevent cancer, but I go back to saying only 10% of cancer is known genetics and a third is lifestyle. So how do we make sure that even someone that has genetics has healthy lifestyle, which reduces their risk or at least prolongs when they are likely to get cancer? So it really is something that is important for all of us as well.
I know that while lifestyle medicine seems complicated, I've learned from you that it really is quite simple. Can you share more about each of the 6 pillars and what they mean to our audience?
Question. We in healthcare love to complicate things, right? We have lots of specialists, which is critical to treating so many of the diseases and situations that happen with our patients. But lifestyle medicine is simply utilizing the 6 pillars. And I really chalk these up to habits, right? So the 6 pillars are exercise, nutrition, stress management, sleep, social connectedness, and risky behaviors. So really what that means is, like, exercise is the amount of exercise that you do, remembering from our earlier talks that exercise is planned physical activity. So it's exercise that you're accomplishing something, you're trying to get stronger, you're trying to improve your energy, or you're training for an event, whatever that may be, or you are rehabbing from an injury. That is also exercise. Nutrition is really focusing on having a plant predominant diet, but also a diet low in processed foods, which we especially see in cancer and chronic disease to being very critical. Especially here in 2024, we understand highly processed foods are significant health risk factors. The third one of this is stress management. And I think this is one of those things that we need to delineate: good stress, bad stress. But we all have stress, but we need to be able to manage our stress, especially in the moment. So we can't avoid stress. Like, we're humans, right? As we're setting up today, dealing with technology things, it's always stressful, but it's like not being frustrated or overwhelmed by stress. How do we respond to it? Teaching stress management strategies as simple as breathing techniques, okay? Kind of some simple stuff. Sleep. Same thing. Sometimes we can't control our sleep, but having a sleep regimen for all of us, time we go to bed, How do we set up our room? Do you do a sound machine on a regular basis? Those kinds of things are really great stress management strategies, accessible to everybody. Social connectedness, which actually some people kind of question this as a pillar, but we know that loneliness is actually a worldwide epidemic that is leading to not only things like suicide, but is contributing to chronic disease as well as poor mental health. So being socially connected, having these conversations, having great conversations with your colleagues as professionals. Think about when you're talking to a professional colleague and you're sharing something in a positive way and you're feeling supportive of one another versus when you're having that kind of debate with someone or someone is being maybe negative on your recommendation, whatever that may be. Social connection is really important. The last pillar, which I think seems simple, avoidance of risky behaviors. The top two risky behaviors we know related to disease are going to be related to smoking cessation, use of tobacco, as well as alcohol. But in the last about year or so, we've added two more to these recommendations, especially in cancer. One, reducing sugar-sweetened beverages. Although I would say that this has actually added sugars across our diet, we know from evidence in cancer that sugar-sweetened beverages specifically have been measured and assessed through very quality studies for increasing like colorectal cancer in young adults. So risky behavior to reduce sugar-sweetened beverages. The last, and I think the most important risky behavior to reduce is inactivity. So our sedentary time is actually contributing a lot to our chronic disease. I don't think most people realize that, but your skeletal muscle is what we refer to in exercise oncology as your metabolic sink, meaning that your skeletal muscle is what is actually going to process and manage your blood glucose. So your body isn't needing to produce so much insulin. So when people have pre-diabetes or diabetes or have, poor metabolic health, I want them to move on a regular basis, maybe a minute, an hour, because I know that inactivity is going to rise their glucose. So thinking about these 6 pillars and these little simple strategies is really translational for all of us. And I'm always, as I reminded on days like today, I have more meetings. So it's like between my meetings, I need to get up for a minute or whatever they may be. But these are really important for all of us. It doesn't matter if you're a doctor, you work in a healthcare office, or you're a patient. We need to make sure that we're implementing these in our lives as often as possible.
That was a great breakdown, Sami. It's reassuring to know that lifestyle medicine isn't as complicated as it may seem. Sami, I know you recently developed a patient-facing lifestyle medicine resource and program for cancer survivors called My Lifestyle Shift. Can you share more about the program and why you created it and why this could be a useful resource for our audience?
Great question. Something I'm really excited about. Just to what we were just talking about a moment ago, I do think people, whether they're doctors or they're individuals, really complicate the 6 pillars, and not because we we don't have access to resources or information, but I think that there's so much confusion. What's the right nutrition diet? What's the diet to follow? How should I exercise? Do I take a supplement? Whatever there may be. It's just so much noise. And I do feel that a lot of the cancer survivor population, whether they're in treatment or out of treatment, or even maybe a caregiver, are really seeking lifestyle because they understand the value, especially related to cancer. And so one of the things that we did is we took all of the recommendations, utilizing strong organizations internationally like the World Cancer Research Fund, the American Cancer Institute, and some of the other international cancer bodies, American Council of Sports Medicine, College of Lifestyle Medicine. We took all of the recommendations into a package where any cancer survivor, no matter where they live, no matter what they have access to, can learn about each of the pillars of lifestyle medicine and find strategies that they can implement. So like we were just talking about with stress management, I think that most people understand they should stress less, but they have no idea where to start. So my lifestyle shift is about making lifestyle shifts to live a healthier life using evidence-based recommendations, but in a practical manner. So through this program, people will learn about breathing strategies or other stress management strategies that they can begin implementing in their life, because our belief system is that by making these lifestyle changes, we can help support individuals to live their highest quality of life, which in healthcare is extra important, because then our doctors are not having to manage this. I just don't think our doctors broadly around the world have the time, capacity, and knowledge to give exercise and nutrition recommendations. And I don't think that's the doctor's job. So these programs are designed to support doctors to focus on the clinical needs that lifestyle does not support or does not really necessarily manage per se, but to be able to give good clinical care and then give a tool where someone can then take the next steps between doctor's appointments to make their clinical care even more beneficial. So our hope is to actually partner more with clinicians and support the amazing work that happens every day in a field that is really burdened and really stressed and really stretched. So that's why we invested into developing this resource.
That's truly commendable, Sami. My Lifestyle Shift sounds like a fantastic resource providing practical support for cancer survivors. It's heartening to witness professionals like you taking the initiative to enhance patient well-being beyond the clinical settings. Now, moving on to our next question. What's one or two things you want our doctor community to know about lifestyle medicine in their practice as they are caring for the patients?
I think that's such a great question, because I do really feel like patients are coming in and asking their doctors for information. And if we think about it, if you have a chronic disease, especially whether it's cardiovascular disease or maybe diabetes, there is this, in cancer especially, ask your doctor about exercise and diet. So we are teaching patients to do that. And I think what is happening is patients are going to their doctors, and of course the doctors are giving good supportive information of why someone should do these things, right? But at the end of the day, I don't think that there is the time or the resources to give really succinct information. Yet at the end, that I do think that we can all do a better job. So if I could give my physicians one piece of advice, I would say that it's really important to give the green light. I think I talked about this in an earlier podcast with this community. I kind of talk about a lot of cancer to be the red light district. We tell people what not to do, but I think our patients are looking for what can I do? And I do think giving them one or two things, right? One or two tools, like again, hey patient, I notice that you're drinking a lot of soda, or a lot of even juice. One great thing you could do is to really reduce that, replace that with water. And have you been exercising or inactive? No. Can you start exercising? Are you comfortable doing it on your own? Can I refer you to an exercise professional, maybe within our system or in the community, or a YouTube video? And I think that just giving one or two simple strategies within the pillars of lifestyle medicine can go a long way to getting a patient and their caregiving team on the right track to start looking at all of these different aspects. And I also think it's important to say that as an exercise professional, we know the recommendation is 150 minutes of exercise per week, 2 days of strengthening per week. I don't think we have to start there to be successful. Sure, we'd love people to get to recommendations, but I often tell people, can you do 5 minutes a day of planned exercise? And if someone says, oh yeah, that's easy, I say, well, let's just do 10. Maybe they could do 30, but if I could have them do 5 or 10 minutes a day, every day consistently for even 2 weeks, they're going to notice such a difference. Then tomorrow when they wake up and they don't have time or energy and they're like, well, I can't do 30 minutes, so I do nothing. So I think the biggest thing that I want to really encourage our doctor community to do is it's okay to think small. A glass of water in the morning seems simple and trivial, but can go a long way to improving someone's energy, improving their, bowel movements. They're not going to be as constipated. They're going to be a little more hydrated. They're just going to feel a little better. And it seems silly. It's one glass of water, but I think these simplistic things can come a long ways, especially from our physicians, because patients will tell you they want to hear from their doctors. 80+% of cancer survivors want to hear from their doctors what they should do. So how do we make sure that we're supporting our doctors and making this simple for you just to integrate already into your busy day? And I think that's important for me as a professional to support the doctor community through the work that you do, because it is so critically important to the care of our patients. Without cancer treatments, we would not have the survival rates that we do. So we want to make sure that we're supporting that role for sure.
I hope the doctors will find this insight to be valuable, as incorporating lifestyle medicine isn't an additional burden, but a means to elevate the care we provide. It's about understanding each patient's unique journey. Definitely. Now, moving on to the final question of the day. How do you see the future of lifestyle medicine?
Favorite question. I really feel lifestyle medicine. We have many colleges of lifestyle medicine. We have such broad ranges of professionals that are part of the lifestyle medicine colleges from around the world. I really feel strongly that it is growing. I know that there is a lot of desire for changing reimbursement and sort of those other more, operational type things, getting policy change. However, I do feel like, especially from the last year, the relevance of small, simple habit changes have really accelerated to make things accessible. Here in the United States, our population uses 20% of our income for food. This, in comparison to other parts of the world, is about double, just because our food supply is really quite expensive right now for various reasons, and the quality has diminished quite a bit because of processed foods. So as an example, it's really teaching people that if they're going to shop at the grocery store, what are the choices that they can make within what they have to spend, what's their time in the kitchen, who are they having to feed, etc. And what I'm seeing is that consumers, although they're really not sure what to do yet, are desiring to make healthier choices. Broad research has showed us that even families that have very limited income means are aware of the importance of quality foods. And so they are looking for ways to incorporate more quality, healthy, nutritious foods into their family meals. And I think that's really important because I feel like lifestyle change is only going to happen if it's coming from various areas. And although I see this change, happening, I always go back to we have to be the change. So I always tell everybody the 6 pillars of lifestyle medicine are my foundation. And sometimes that just means I'm going outside for 5 minutes and taking a walk or calling a friend or, grabbing a glass of water. But I think that we could all do a better job. And I think especially for our doctor community that is really working in stressful, challenging environments, we have to take care of ourselves first, that whole put your oxygen mask on first thing. And I see that shift happening. But let's not forget that simplistic changes can go a really long ways. And I want to empower doctors to do that, not just through like the SHIFT program, but just thinking about that mindset, because I do think that not only is going to help our self-care, but it's really going to help our patient care and really shift the needle into wellness in the coming years in our world. And we really do need it right now, from physical to mental health. So I'm hopeful for that, but it's going to take all of us. So I think it's a really important message to share.
Sami, a very big thank you for sharing your expertise and knowledge on cancer, obesity, and metabolic health today. Your contributions are always enlightening, and we truly appreciate your valuable discussions on our MedSynapse platform. It has been a pleasure having you on MedSynapse, and we look forward to more collaborations in the future. Thank you so much.
Thank you so much. It was so great to see you, and Happy New Year.
Happy New Year, and wishing more successful steps in your career and more interesting discussions to come up on our platform together. Thank you so much, Sami.
Make it a busy year. Thank you for having me.
Thank you so much. And as we wrap today's podcast, a special thanks also goes to our incredible audience for joining us. Your participation is what makes the conversations impactful. If you enjoyed this discussion on cancer, obesity, and metabolic health, don't forget to like, subscribe, and stay tuned for more engaging content. Your support means the world to us. Until next time, thank you for being a part of MedSynapse community. Goodbye.